Good afternoon, and welcome to our online discussion of euthanasia, assisted suicide, and other ending of life questions that affect people with disabilities, sponsored by Toujours Vivant, Not Dead Yet, for June 20th, 2014. My name is Amy Hasbrook, and I'm the director of Toujours Vivant, Not Dead Yet. We are a project of the Council of Canadians with Disabilities to unify, inform, and give voice to the disability opposition to assisted suicide, euthanasia, and other ending-of-life practices that have a disproportionate and discriminatory effect on people with disabilities. We are, oh, why am I? I'm looking at the French text. That doesn't make any sense. Sorry about that. We have several reasons for opposing euthanasia and assisted suicide. In fact, many reasons, but here are some of the principal reasons. First of all, we believe it's unnecessary because people already have the option to refuse medical treatment. Obviously, everyone has the option of suicide if that's what they really want. And people have the option to refuse medical treatment and to have palliative care until such time as they die of natural causes. Secondly, we, as I said, believe it's discriminatory because our society has a public policy to prevent suicides, but this policy is not applied equally to people with disabilities. So, for example, if a 40-year-old woman loses her family in a natural disaster, she will feel a loss that will affect her for the rest of her life. Similarly, a 40-year-old woman who is diagnosed with multiple sclerosis will feel a loss that will affect her for the rest of her life. If both women feel suicidal, the first woman will probably not be, why did I do that? The woman who has undergone the natural disaster will be supported to not commit suicide, probably discouraged from committing suicide. Even if she becomes too depressed, she may be even
alert from calendar.
Put
TVNDY Euthanasia and Disability, June 14th, 2020.
Yeah, I know. Excuse me. Probably put in a psychiatric hospital to prevent her doing harm to herself. Yet the person with a disability may, people will say, oh yes, I can understand why you wouldn't want to die. Your life is over. And if assisted suicide or euthanasia becomes legal, she may be even helped to kill herself. And that's what we believe is discriminatory. Also, the laws talk about having a free and informed choice, but we do not believe that as long as people with disabilities, who are in fact the main people euthanized and killed under these programs, as long as people with disabilities do not have equal access to all the basic advantages of life, to living where they choose to having a decent income, to being able to move around in the public sphere, have access to public buildings, public transportation, that sort of thing, that there is no real choice involved, that people are essentially coerced by the circumstances to die, and that it's not their disabilities that are the coercive factor, it's the lack of equality and supports. And finally, the laws where they exist are supposed to provide safeguards, but those safeguards are not effective in preventing the deaths of people who should not be killed under such programs. The goal of our discussion is to give people with disabilities an opportunity to talk about these issues among ourselves, especially because the media portrays the debate on this issue between conservative religious people on the one side and progressive intellectual liberals on the other side. And yet the disability perspective gets lost. Everybody chooses to ignore it. But in fact, the disability rights perspective is really more progressive than the progressives. And most of us with disabilities have very direct experience with how the medical system can go wrong. And to be able to talk about that among ourselves and how that can be threatening on a personal level and on a political level can really be helpful. And also to be able to hash out some of the issues, because not everybody agrees, and I think it's a good way for us to inform each other about our opinions and how we came to those opinions. So that is why we set up these discussions. There are several ways to participate. One is there is a YouTube link, which I send around within the half an hour before we start. I send around both a tweet and on our Facebook page, as well as emails of the links to access the discussion. So if you want to be on that email list, please email me at tiglily61@gmail.com. And you can either watch us on YouTube if you have received the link or seen our tweets, you can link to there, or you can search for us on YouTube. You can also search for us on Google Hangouts on Air, where you can either just watch or you can come into the Google Hangout, where we will be able to see your lovely face and hear your comments. So that gives people who have trouble writing a better access. We also have it set up that people can write in their questions, so that it works for people who are shy or don't want to speak on the air. You can finally, on our website, you can go to tvndy.ca, click on the events tab, and go to today's date, and you will find today's discussion. Okay, finally, if there's anything that you see or any information you want about what we talk about today, you can find it on perhaps on our Facebook page at facebook.com/toujours vivant, not dead yet. You see the name written under my name there. And you can go to our website, which is tvndy.ca. And I should say I update the Facebook quite often, although most of the information is in English. For our French viewers, I had to explain that there is not a lot of information out there from the disability perspective in French. So there's a lot of good information in English, and I try to pass it along as quickly as possible. I also have a Twitter feed, which is @TVNDY, and of course our website. And again, my email address is tigrlily61@gmail.com. Okay. Let's see. Okay. We have 3 topics today. First, there was a survey that came out from the Gallup company this week, and I wanted to go over a little bit what happens when you see statistics on surveys that say X number of people slipping back into French. A certain number of people say approve of euthanasia or oppose assisted suicide. You have to look deeper than the numbers to see what that means. A frequently asked questions segment, we're on part 12. 12 is my favorite number. So here we are on part 12, and we'll go into that a little bit. And finally, I have a commentary on the exoskeleton event at the World Cup. Okay, so when you hear the results of a survey, you'll hear that X percentage of people oppose euthanasia or X number support assisted suicide or whatever. It's really important to go beyond the numbers, because those numbers are influenced by so many factors. It's useful to know what the factors are that are influencing those numbers. So this week we saw a survey by the Gallup company that was done this year, about a month ago, of 1,028 people. The first question they asked was, when a person has a disease that cannot be cured, do you think doctors should be allowed by law to end the person's life by some painless means if the patient and his or her family request it? And 69% of people surveyed answered yes to that question. So let's pull apart that question a little bit first. First, it talks about incurable illness, and the question isn't specific, but we all know that incurable illness can sometimes mean disability or sometimes not. So people often think of cerebral palsy as an illness. No, it's a condition. Further, I have lupus, but a very mild form. That is an incurable illness. And most of the time, it is not at all disabling. But sometimes it can be disabling, and some people have lupus in a much stronger, more, not stronger, but more debilitating fashion that interferes with their life quite a bit. Both of them are incurable illnesses, but some people are much more disabled by it than others. And on the other hand, there are people with spinal cord injuries who are not ill, but they are disabled. And so when they say incurable illness, they're not being very exact. Also, the survey did not indicate whether they're talking about terminal illness. And most jurisdictions where assisted suicide and euthanasia are legal talk about a terminal illness, or a person has to be within a certain amount of time of death. Most, but not all. And even though those are not always very well defined, and we know that medical predictions of death are always inaccurate, and most people with disabilities have had either themselves or know somebody who's had a prediction that they survived. Be that as it may, the survey didn't indicate whether the illness was supposed to be terminal. And finally, there was no indication about pain in that question. So in that question, to be specific, the act considered was euthanasia, the doctor acting, and the person or the family would be making the request. So knowing all those conditions, it was 69% of the people said yes, that they should have a right. Moving on to the second question in the Gallup survey, when a person has a disease that cannot be cured and is living in severe pain, do you think doctors should or should not be allowed by law to assist that patient to commit suicide if the patient requests it? 59% of people said yes. Now, in this question, there are 3 factors that have changed from the first question. So, in understanding why this 58% of people said yes to this one, but 69% said yes to the other one, it's not really possible to figure that out because there are 3 factors that are different. First of all, some of the information is the same. In other words, they still talked about an incurable illness. There's still the question about whether it includes disability. There's still the question about whether or not they're referring to a terminal illness. But this time, pain is included. So that's a difference. And the second difference is that the act is assisted suicide as opposed to euthanasia. And in the first question, they pointed out that the euthanasia would be painless. This one, they didn't say it would be painless. And the third difference is that the request would come from the person, him or herself, not from the person's family. So those are 3 factors that are different in the second question. So the 11 points different in the survey response is impossible to know what factor changed that. So usually it's better when survey companies try to do a better job. And here's an example of a slightly better job that was done last year by the Pew Charitable Trust. They did a survey of, or the foundation, I think, the Pew Foundation. Anyway, a survey last year of 1,994 people. And in their survey, 66% of respondents said that there were some circumstances under which doctors should be allowed to let a person die. This is an important difference already, because in this survey it's talking about letting a person die by a natural cause. So that's not either non-interfering, non-intervention, or withholding or withdrawing treatment. So that's neither euthanasia nor assisted suicide. And then when talking about themselves, people said that they would ask a doctor to let them die under the following conditions. One, if they had an incurable illness and were in pain, 57% said that they would ask their doctor to let them die. And again, the same lack of clarity applies when we're talking about incurable illness. And when they talk about pain, they're not talking about whether palliative care has been attempted, not whether it's available, all those things. They're not discussing that. Secondly, if they had an incurable illness and they were totally dependent on others. Totally dependent being a pretty vague term and could mean different things to different people. Some people think of total dependency as not being able to drive. So that's up to the individual definition, but in that case, 52% said that they would ask their doctor to let them die. And the third case, if they had an incurable illness and had difficulty functioning on a daily basis, 48% would ask their doctor to let them die. So in this situation, each time only one factor was changed. So it gives a much clearer idea of what is changing, what is influencing people's responses. Also in the Pew survey, people were asked the direct question, do you approve or disapprove of assisted suicide? 49% were opposed to assisted suicide, 47% supported it, and the rest were not sure. I think that's 3%, or 4% who were not sure. So, okay, looking at all of this, and actually I should also say that these factors, online polls are even less reliable because they are very strongly affected by organizations, groups that have an interest in them. So, for example, if a group discovers an online poll and they want the result to come in a certain direction, they'll send out messages to their friends, and that will go around saying, go to this poll and vote on it. This happened a little bit this week. There was a online debate question about whether children with disabilities should be euthanized. And when I first heard about it, it was 60% in favor of euthanizing children and 40% against. But by the time I saw it yesterday afternoon, it was 20% in favor and 80% against, or 78% to 22%. So just activism and response by activists can really change the results of an online poll. So the 3 points to take away from this little bit of information here is that the Gallup poll, there was confusion in the questions, and that probably affected the result, but it's impossible to say how. The second is that the confusion between illness and disability is very common in both surveys. It's common to both surveys, and it's also very common in general. In almost everywhere, people confuse disability, illness, that kind of thing, but the problem is that regardless of the wording, people often are thinking of people with disabilities when they think about euthanasia and assisted suicide. So we can't rely on the fact that people are saying, oh, well, illness. And we're saying, well, no, I have cerebral palsy, so I don't need to worry because that's not an illness. don't count on it. Okay. And finally, the questions that are asked shape the response and therefore the data that comes out. So again, when you see a thing that says, the data that would come out of these two surveys, one survey would say that 69% favor euthanasia, and the other would say that 47%, only 47% favor assisted suicide, and 49% oppose it. So it looks like the opposite. And if you don't read it carefully, and if you don't dig any deeper, you'll get possibly incorrect impression. So, okay. All right, let's move right along to frequently asked questions after I look and see if anybody is watching us on YouTube. No comments on the YouTube side. Okay, let's go right back to our Hangout and watch and see if we get any questions. Okay, the frequently asked questions, part 12. Okay. As I may have mentioned before, we do this frequently asked questions document was created in 2012 and has been continually developed and updated since then, and it reflects questions that those of us who work in this area hear all the time, and how we want to respond to those questions. So first of all, the next question I wanted to go over is, isn't assisted suicide a personal issue? It's not as if the state is killing people. And our response to this is that as soon as the person asks for suicide assistance from a doctor or pharmacist in a society where those services are paid for by the government, it is no longer a personal issue. It is a political choice by the government how it's going to deal with these situations. So no, it's not personal. The public policy of suicide prevention also makes the issue of assisted suicide a personal choice, because by having a policy and spending government money on suicide prevention programs, we have made the issue of suicide into a public issue. And also by having laws that say if somebody is behaving in a suicidal manner, that person can be put against his will in a psychiatric hospital. That makes it a political issue as well. So we can't, in those cases, we are making choices about how we treat certain people who are showing a desire for suicide. And so when we allow assisted suicide, or even think about it, we are making other choices about other people who are asking for suicide. And these laws are essentially saying that, two people asking for suicide, or two women that we talked about before, the 40-year-old women, one person is going to be chosen for suicide prevention because we judge her circumstances to be worth going on, yet the other, who has MS, will be, not chosen for suicide prevention, not steered in that direction, and, because she has asked for it, she will, she may get suicide assistance, because this is how we value people with this kind of disability. Let's see, the issue, another way in which it is not personal is that the people who are trying to change the law are bringing the issue out of the personal into the public arena. So that's another way it's not personal. The issue has already been debated and decided by Parliament. It's been debated many times, 12 times I believe it's been up before Parliament since 1990, and the most recent time was in 2010, and that doesn't include all the court decisions that have happened on the issue in the interim, and reports and such and such. The government should not have to provide a service that would go against its principles and values. If doctors who are employed by the health service using facilities and equipment funded by the government under a program developed, implemented, operated by the government, prescribed or administered deadly drugs, that would make the government directly responsible for that action. So if the government is killing people using, doctors who are government, ultimately paid by the government, if they're killing people, that's the government acting. And finally, by allowing assisted suicide, Canada would be saying that some people are less worthy of suicide prevention than others. And, that's what we mentioned already. So if somebody says to you, well, I'm going to take a neutral position on this because it's a personal issue. It's not a personal issue. It's a political issue. Because it's been made political by our public policy. It's been made political by people who are pushing to legalize it. And it's been made political by the fact that it would be a government-funded program. So it's not personal. And, taking a neutral stance is equivalent to taking a stance in favor, essentially, because it's letting the process go through as opposed to speaking out against it. It's letting the winners, the people who are predominating, the predominant message, it's letting that pass. Okay. Isn't this about choice? People talk, this is my body, my choice. That's what they say. My body, my choice. Okay. In reality, there can be no free choice to die as long as essentially people don't have choices in where and how they live. And I mentioned that earlier, but let's go a little deeper into that. Let's dig down there a little bit. If you don't have access to effective palliative care and you're in pain, that's affecting your mind. It's affecting your mood, it's affecting your thinking, it's affecting your judgment. That is not a free and informed choice. That's a choice made on the basis of an impaired mind. It may not be impaired in all ways, but it's certainly impaired in a certain way and toward a certain direction. Palliative care will, and easing pain will, enable you to feel better. And people who focus on, doctors who have experience in this, suicide prevention, when those treatments and techniques have been used on people who request assisted suicide, the requests generally diminish. Whether it's through giving antidepressants, whether it's through counseling, whether it's through grief counseling, spiritual, helping the person find some spiritual orientation, all of those things help people move away from the desire to die and toward the process, if the person is actually dying, toward a process of going through the dying process, which is actually part of the living process. Okay. If healthcare is delayed or denied to people with disabilities based on economic factors and accessibility, a lot of people with disabilities can't get timely and adequate health service. So, for example, a woman in a wheelchair may not be able to use the mammogram machine. A person who's deaf may not have access to an interpreter to go to the doctor's visit, and may, in fact, as often happens, has to recruit a child or one of their children or another relative to interpret. Or somebody who's unqualified and doesn't know what they're doing and may do a bad job of interpreting. A person with a cognitive disability may not understand a lot of what the doctor is saying. And if the doctor doesn't make any adaptation or modify the way he explains things, that might not work. Someone who's blind may not be able to read the information that's given, or if the websites to find the information are not well put together, not usable by reading software, then that information is not accessible. So if you're denied health care, that's going to affect your health. It's going to perhaps worsen your circumstances, and it's going to ultimately affect your choice about whether to live or die. People who don't have home care services are often forced into institutions or have to rely on family so much that they feel like a burden. Again, this is a circumstance where people are denied choice in one aspect of life, but it ultimately ends up in affecting their decision whether to live or die. If they feel they don't have an option to control where they live and how they live, then they don't feel that, they feel the only choice to improve their situation is to die, and that's not a choice, People with disabilities do not enjoy equal access, status, or rights to participate in society. If they don't have those rights, if those rights are not realized in, right to circulate in society, public transportation, if they don't, if the right to have access to public buildings is not real because the buildings are inaccessible, that's not a right. And as long as people don't have those choices, then again, their choices are limited artificially, and the choice to die then is not a free and informed choice. Let's see, anyone can ask for assisted suicide, but it's up to the government eligibility criteria and the doctor's judgment who is going to get the assisted suicide or euthanasia. So again, it's not the individual's choice. It's the decision of the government it's the decision of the doctor based on the eligibility criteria. And you know what? Those eligibility criteria, they always include people with disabilities. Funny how that works. It doesn't include teenagers who just broke up with their boyfriend. It doesn't include, people who just got, a transgender adult who just got beat up by a gang. It doesn't include a lot of people, but it sure does include people with disabilities, and that's not a choice. Okay, next question. What is the difference between withholding or withdrawal of treatment and assisted suicide or euthanasia? Are they the same thing? Well, that's a good question. Okay, there's a big difference and several important differences. First of all, when a person asks for medical treatment to be taken away, withdrawn, or to not be given, that's withholding, they are saying that they don't want to be touched in the sort of legal sense of the word, or that they want the touching to stop. So if you are on a respirator, the medical system is touching you in a certain way. So that's the legal idea. And so the right not to be touched has been recognized by many courts in the most basic and important right. And this was established in Canada by the case of Nancy B. versus Hôtel-Dieu de Québec. And in that case, it was a woman with Guillain-Barré syndrome, and she wanted to have medical treatment withdrawn, and she won that right from the court. The right exists. It's a discriminatory right. People with it's based on the idea that life with a disability is a fate worse than death, and that if the court had seen things differently, then that quote-unquote right might not have been accorded. But unfortunately, that's how it worked, and so this is what we have to work with now. It's the standard. It's, you know, it has to be our fault. It has to be, we have to deal with it as it is. We don't have any choice. So that's what the right of withdrawal of treatment is. When a person asks for assisted suicide or euthanasia, on the other hand, they're saying they want something to be done to them, okay? And people can ask for any medical treatment, but there's no right to any and every treatment that they ask for. Okay, so when somebody's withdrawing treatment, they're taking away something that has been done or is being done. When asking for assisted suicide is saying, do something to me. And that's one difference, is it's the person, someone is, the doctor is doing an action on the person, okay? And there's this idea that, you know, you can request a medical treatment, but you don't get every medical treatment you want. If you go in for a hangnail, you can't get a lung transplant because you don't need it and they aren't available and yada, yada, yada. So you don't get every treatment you ask for. The doctor gets a lot of say in that, and also, you know, that's the kind of decision that doctors make. And the decision about whether or not to give assisted suicide, in this case, is guided by the government policy. The fact that if the government makes it legal, that's one thing, and then the government has certain eligibility criteria that make it legal for certain people. Okay, unlike actions that cause death, withdrawal of medical treatment is not usually done with the intention of killing. Okay, sometimes if somebody is recovering and needs to start breathing on their own, you turn off the ventilator. Not necessarily trying to kill them. Assisted suicide and euthanasia are designed to kill the person, and that is the most likely outcome. Okay? When someone dies after medical treatment is stopped, the cause of death is the underlying illness or condition, or a combination of the illness and absence of treatment. If somebody stops having kidney dialysis, they're dying because they have kidney disease and a buildup of poison. The kidney dialysis takes the poison out, but it doesn't cure the kidney disease. So that's how somebody, you know, that's the difference. If somebody wants assisted suicide who has kidney disease, the doctor will come in and give them an injection of poison, and that's the difference. When somebody, okay, yeah, and let's see. When someone dies from assisted suicide or active euthanasia, the cause of death is the administration of the poison, and legally it's very different. Here's the next question. Many ethicists and scholars believe that withholding treatment and assisted suicide are the same thing. Shouldn't they be treated as the same under the criminal law? And essentially my answer is no, because they're not the same thing. Yeah, the opinions of ethicists are divided on this question. Most of the people who say they're the same are also the people who support assisted suicide, so that kind of gives you an idea of their agenda. Withholding and withdrawing treatment, let's see, oh right, the opinion is divided as to whether they're the same, but as I said, most people who support assisted suicide think they're the same. Courts and statutes, on the other hand, say that for the reasons I already stated, that they're different and should be treated differently under the law, and I think we need to go with the law on this. The fact that I used to be a lawyer has nothing to do with that. Okay, I have a commentary. That's the end of our frequently asked questions file for today. I think we have one more session of those. And you can always find them on our website, which is tvndy.ca. My commentary today has to do with the exoskeleton shenanigans that happened at the World Cup. As some of you may know, there was a paraplegic person who came out at the beginning of the World Cup being supported by an exoskeleton. I don't know if the person actually walked anywhere, but the person gave a little kick to a soccer ball, and that was the opening of the games. And a lot of people without disabilities were all excited about this, and a lot of people with disabilities were really disgusted and offended by this. So why the difference? And I can give you the answer in 2 words: inspiration porn. And that is a term that is used to describe the kind of, well, it's used to describe that sort of thing where people with disabilities are portrayed in a way that's designed to make people without disabilities feel good. And so it's for people without disabilities. It focuses on the person, it focuses any problems on the person's disability, not on the society that restricts them. And in this case, it offers a vision of a way to remove the problem so that the person would eventually be, quote unquote, normal, in at least a facsimile of normal, kind of like normal. And in the disability, people with disabilities talk about the medical model of disability, which has to do with curing whatever makes you disabled. The rehab model, which has to do with giving people equipment to make them, quote, normal, and this is a case of that. Or the social model, which says, hey, we're all right the way we are. It's the society and the environment that aren't working right for us. So the other thing about this, the idea of an exoskeleton and making people seem normal, is that it creates a sort of goal that people with disabilities are supposed to strive toward walking, or in this case, walking. That's the best thing, and this is the direction you're supposed to go in. I often say, I don't care if I can see or not, but I want to be able to drive. And driverless cars will probably do that for me within the next 15 years, which would be cool. So it's not that I need to see, it's that I want to be able to have the privilege of going around in an automobile by myself, deciding where I want to go and taking myself there. So it's a little the way you look at it. In the specific case of these exoskeletons, the technology is not that useful right now. It's very clunky, it's very unstable, it doesn't help that much. It may help a little bit with circulation issues, but it's cumbersome and not that useful. But a lot of people, the counter argument to that is that when things are invented, they go through phases where they're not very good and the technology improves and yada, yada, yada. And right now, this technology is very expensive and it diverts resources from other options that enable people to live more comfortably. And also, it diverts fund. It's so expensive that nobody can afford it. Nobody, none of the people in the favelas outside of the stadia in Brazil could afford that. But the other reason that this kind of technology is bad is that it creates this obligation for normalcy, and also for people who are just fine in their wheelchairs and say walking is overrated, it kind of puts that idea down. Like I said, it centers the problem in the person and not the society. And when you do that, what you're doing is centering the problem in the person, reinforces the negative view of disability, and thus, and that leads to devaluation and what we've talked about, how that reinforces the ideas behind euthanasia and assisted suicide. So it might seem innocent. Oh yeah, isn't that lovely? That person can get up and walk. No. First of all, the person can't get up and walk. Secondly, the expectation is not that, you know, society will adjust to people with disabilities, but that people with disabilities have to adjust to the rest of society, which is not a legitimate assumption. And it diverts money away from real help that could be used, and not just the research for that exoskeleton, but all kinds of research that goes into toward finding cures, quote unquote, and away from helping people live. And that's especially an issue for groups like Autism Speaks, who make a lot of money by portraying autism as a horrible thing, which can lead to the deaths of autistic kids. So these are not just sort of, it may seem like it's not bad. Oh, you know, it's just being nice, but it is bad. So there you go. Okay, to get in touch with us, you can email me at tigrlily61@gmail.com. You can visit us on our website, which is tvndy.ca. You can follow me on Twitter at TVNDY, or visit us on our Facebook page at facebook.com/toujours vivant, not dead yet. We have these conversations online every week, which are not conversations because nobody has asked any questions. I should make sure to check again. No, there are no questions over on the YouTube page either. They would be conversations if people spread the word and people came into the chat room. But right now, what we're doing by continuing to have them is creating a record of information that's available in video format in French and English, because we do a French discussion at 1 p.m. And also giving people an opportunity to learn about these issues. And like I said, they're all available on our website. Go to our website and click on the date on the Friday, and it should be available. I have to put up the most recent ones. I'm a couple weeks behind, but you can go back and listen to other discussions that are online chats that I've done in the past. We started last September and have gone since then, with a short break in November and December. Okay, so thank you very much for being there, and hopefully you will be there again next week, and let your friends know and let other people know that we're happy to hear from you. I will be here next week, and I look forward to talking with you then. Take care, have a great week, and see you soon. Goodbye.